So with that, I'm very pleased to welcome our first keynote speaker, Jahred Liddie. Jahred is a doctoral candidate in Population Health Sciences and Environmental Health Department at Harvard T.H. Chan School of Public Health. He is a member of the biogeochemistry of Global Contaminants Lab, led by Professor Elsie Sunderland. His doctoral research focuses on the sociodemographic disparities in drinking water contamination by per and polyfluoroalkyl substances, or PFAS, temporal trends in PFAS drinking water contamination, and impacts for population health due to widespread PFAS exposure. Jahred is originally from Central New Jersey. Before starting graduate school, he was a sustainability consultant at Sphera, or formerly ThinkStep, where he where he primarily conducted environmental life cycle assessments. He received a BA in Environmental Sciences and Engineering from Harvard College and his master's in Environmental Health from the Harvard T.H. Chan School of Public Health. So Jahred, thank you for joining us, and the floor is yours.
Thanks so much for that introduction. So I'll start and share my screen. So hopefully you're seeing the first slide now shared.
Yes, it looks great.
Awesome. So thanks everyone. So before I begin, I want to first thank the conference organizers for inviting me to give this talk and all their efforts in putting this conference together. I'm really excited to be here and to have the opportunity to speak with you all. So in this talk, I'm going to be posing the following as a research question: who is most exposed to PFAS in drinking water? And I'm aiming to give some answers to that question using my own doctoral research. So in this keynote, I'm also going to be touching on social issues, although guided by quantitative approaches for the most part. And then I want to end with a discussion on some of the limitations of that work, and really try and use those limitations and data gaps to as an impetus for us to be able to answer that question better in the future, and I think ultimately try to improve drinking water quality for all of us. Before we begin, I want to give just a quick summary of my background. It may be a bit different from many of the attendees here, so just to kind of give a sense of where I'm coming from. So again, I'm a current PhD candidate in environmental health. I'm at the Harvard T.H. Chan School of Public Health. My primary interests are kind of in these domains, so include per and polyfluoroalkyl substances, as we'll talk about today, and there's another keynote later today on that. Exposure disparities in environmental justice, which are really the focus of my talk today. Also broadly interested in epidemiology and population health, exposure assessment, and other kinds of drinking water quality issues. And my research, I'm primarily using these sources of data and these tools. And some of these I'm going to be talking about today. So administrative data, state sampling data, which is what a lot of my research is based around, and also laboratory methods and laboratory generated data in our lab, and typically analyzing those using statistical models. And I'm also really interested in these other two topics and how they kind of relate to these interests and these tools, and communicating that to other researchers and other audiences. So really interested in data visualization and science communication just in general. So as I begin, I want to first give some context on disparities in environmental health to sort of ground us before talking about this in more specifics. So there's kind of two main points here. The first is related to environmental exposure disparities. And these have been identified for many exposures, and we're talking about comparing different sociodemographic groups to one another. And these have also been identified for drinking water contaminants. And then a related concept is the idea of environmental health disparities. And these are theorized to occur due to these exposure disparities, as well as differential vulnerability between demographic groups. And then connecting this back to environmental justice, when we're talking about environmental justice, we're really talking about an equitable distribution of environmental benefits and protection from environmental hazards. And really an opportunity for individuals of all backgrounds to be able to impact decision-making related to those factors. And what I'm discussing today is really focused on this first point related to exposure disparities, but the second one is still an important factor to consider. And then this slide is talking a bit more about some of the mechanisms that other researchers have highlighted as causes of environmental justice broadly. So this is across sort of all domains related to the environment, not just drinking water, but air pollution and other kinds of environmental hazards. So to give a short description of each, disproportionate siting is a phenomenon in which polluting facilities have been observed to be more likely to be sited in areas with greater proportions of marginalized racial ethnic groups, as well as lower income groups. And that's typically as a result of decisions either by firms or governments. And this one is one to keep in mind as I'm going to talk about my research. Sorting and bargaining are related concepts in economics and really describe the interplay between firm-related siting decisions, communities, and typically also their willingness to pay either to avoid environmental harms or gain environmental benefits. Discrimination is this much larger concept relating to centuries of discrimination and racism, some of that being related to historical segregation enforced by law. There's also redlining related to that, and housing discrimination that continues to this day. Another one highlighted here is regulatory inequities. So that can happen as a result of government inaction, wherein marginalized racial ethnic groups and lower income groups become inequitably exposed due to sort of lax regulatory decisions. Related more specifically to drinking water, we can use this drinking water disparities framework to talk about this in more detail. So this is a framework posited to describe mechanisms that produce drinking water exposure disparities in the US. And it comprises three main parts shown here. So the natural environment, the built environment, and the socio-political environment, which affect actors at all sorts of different scales, including the national level, regional level, the state level, all the way down to the household level, ultimately to impact individual exposures. So in the natural environment, these are just showing some of the descriptors related to each of these. So that could include the climate, hydrogeological conditions and the soil, the built environment, including things related to land use, agriculture, and infrastructure. So that could be infrastructure of the treatment facility, for example, and the socio-political environment referring to historical settlement patterns, planning and regulations, and social vulnerability. And so this framework was really developed more with a focus on naturally occurring drinking water contaminants like arsenic, but it can be easily expanded, I think, to others like PFAS, as I'll discuss. And then this is, I think, a quote that is really relevant for drinking water disparities research, and I think undersold in general in the disparities literature as a whole. I think it's important, especially when we're talking about mechanisms that are related to exposure disparities. This quote reads that one could still argue that there is an injustice, even an injustice at the level of racial groups, when there are inequities in the simple correlations, even if these correlations are the result of socioeconomic processes. Simply because the inequity is mediated through some mechanism does not mean it isn't there. So as I've talked about these mechanisms, I think they're important for us and helpful for us to ground existing disparities in processes that we can observe, and also can kind of give us a guide on how to eliminate disparities, but they in themselves are not necessarily justification for existing disparities or disparities that we observe in our research. So I want to step back and also, as I begin talking more about PFAS specifically, I want to highlight a few themes in the environmental justice movement that I think have pretty important implications for PFAS, these substances. So the first is related to kind of the siting issue. And we see with historical discrimination and segregation in the US throughout various studies that these have shaped where and how industrial sources of pollution are patterned around the country. And so this is discussed in 3 landmark reports in the late 80s and early 90s, including the Toxic Waste and Race Report, Dumping in Dixie, which was authored by Robert Bullard, who is a key figure in the early environmental justice research phase. The US EPA's National Report on Hazardous Waste Facilities, shown on the rightmost here, also documented disparities across the country in where hazardous and waste producing facilities were located in the US, related to race and income. And these three initial reports were catalyzed by protests occurring around this period by environmental and civil rights activists, including a large protest that occurred in Warren County, North Carolina, against the development of a hazardous waste landfill within a predominantly Black community. Related to drinking water more specifically, there's research undertaken by other researchers documenting that the racial and socioeconomic composition of communities can be a key predictor of drinking water quality. And this is specifically for communities that have faced historic as well as face present day discrimination. So we can see this in this map here, developed by the National Resources Defense Council, where maximum contaminant level violations for federal regulations for drinking water and racial, ethnic, and linguistic factors are overlapped. Because we're moving into the top right of this box is where both of these things are co-occurring. So in many regions of the US, you can see these darker colors where there's potential evidence of disparities for those groups. Bringing this back to PFAS, I think both factors are likely important and have guided the research that we're going to talk about today. First, that there are known sociodemographic disparities in the siting of polluting facilities occurring over many decades, as well as disparities that other researchers have noted in drinking water quality more broadly. So as many of you already know, PFAS, among many things, are drinking water contaminants. I'm going to give some overview of what they are in terms of being drinking water contaminants and what PFAS are in general. Of course, there's another talk later today that will go into more depth on that. So this is not the full intro, but provides some intro related to drinking water more specifically. So this is kind of meant to explain what the state of PFAS monitoring in drinking water has been around the US over the past few years. So in 2013 to 2015, there's a nationwide survey that the EPA conducted that included PFAS. It was meant to better understand unregulated contaminants, and PFAS were one of a few that they analyzed in that survey. And this is the third unregulated contaminant monitoring rule, or UCMR3, which I'm going to talk about in more detail later as well. And a study coming from our lab in 2016 analyzed these data and documented that several sources, including military fire training areas, airports that are certified to use firefighting foams containing high concentrations of PFAS, as well as industrial sites where PFAS were historically manufactured or used, and wastewater treatment plants were associated with increases in drinking water concentrations of PFAS. And so those detections in that survey are shown in these regions around the US. And since then, a range of studies have estimated population-wide exposures to PFAS around the US, with one reporting that up to 200 million US residents are exposed to PFAS via drinking water, specifically two compounds, PFOA and PFOS, above 1 nanogram per liter. And since then, several states around the country have monitored drinking water around their regions for PFAS and enacted their own state level regulations, as I'll talk about more. And throughout this talk, I'm going to be saying this word community water systems. These are specifically public water systems that serve the same population year round. So this is public as opposed to private water systems, which may serve a residence or a group of residences. And since then too, I don't want to neglect to say that UCMR5, this is another nationwide survey happening currently, includes an expanded list of PFAS is underway nationally. And of course, with the newly finalized regulations for PFAS in drinking water, there's going to be a lot more testing happening over the next few years. So why do we care about PFAS? Why would we bother to study them anymore? So as you know, PFAS have these characteristic carbon-fluorine bonds that grant them high environmental persistence, and also giving them that forever chemicals moniker that you've probably heard as well. They're also a very large chemical group. I think the last numbers I've seen on that are in the tens of thousands. And as I said before, the scope of exposure for populations is vast, both through drinking water as well as other exposure routes. And also the health effects identified in terms of that exposure are varied and numerous, some identified also at low levels of exposure, and also for sensitive subgroups like children. One of them also being immunotoxicity as a key effect, and actually used as a critical effect in these drinking water health advisories that the EPA released last year or the year before, as a critical effect in developing these advisories at very low levels in that case. And the more recently finalized maximum contaminant levels for PFAS have these maximum contaminant level goals that are based on associations with cancer. So that is shown up there as well. So moving more into this research more specifically, we had 3 primary research questions in enacting this study. So the first is sort of a revisit of that prior study I mentioned from 2016, and it relates to associations between sources of PFAS and PFAS concentrations in drinking water around the country. And the second and third here are relating more to these questions related to exposure disparities. So the first is on disparities in the siting of PFAS sources in proximity to community water systems. And then the third is related to disparities in detections of PFAS in community water systems. And to answer these questions, we synthesized and compiled and harmonized a bunch of different data sources. So this is summarizing what those were. So these included data from the US Census, including data on racial ethnic composition and socioeconomic factors. In our primary analyses, we focused on the percentage of non-Hispanic Black, the percentage of Hispanic and Latino residents, as well as the residents under the federal poverty line. Although in other analyses, we analyzed other racial ethnic groups, as well as other socioeconomic factors. These also included a group of PFAS contamination sources. So many of the same being those that were analyzed in the prior 2016 study, including airports that are certified to use firefighting foams containing PFAS, military fire training areas known or likely contaminated with PFAS, major industrial facilities that have produced historically legacy PFAS in particular, as well as municipal solid waste landfills and total wastewater treatment plant effluent. And so many of these areas are shown here in this map. And then we also compiled and joined all these data with administrative data from what's called the Safe Drinking Water Information System. So this is a database that the EPA manages, and it includes water system characteristics like the population served by a water system, the type of public water system, the source water that water system is using, as well as the county or counties served by that public water system. And then really the main part of this is that these were combined with statewide monitoring data on PFAS in 18 states from the 2016 to 2022 period. So this is all after the conclusion of that nationwide survey that the EPA did, ending in 2015. And these data were all either retrieved online by request, and in some cases by FOIA request as well. And the states included here have undergone sampling for a variety of reasons, some including monitoring as part of their own state level regulations, some being more targeted surveys to understand contamination after that survey happened. Before I move on, I wanted to show this little preview of an interactive map that we have available. So as part of the study, we also made this map. And this GIF is kind of walking through some of the basics of that map. So we have these watershed regions shown there, where we have available the maximum detections of 2 PFAS, PFOA and PFOS. In those regions, we also have county level detections of PFAS among community water systems serving those regions, as well as which PFAS were detected, as well as information about that county in terms of its sociodemographic composition. And we also have some of the sources available to view around these regions. So these include military fire training areas, as well as these facilities that historically manufactured PFAS. And so that is available online, and happy to share a link as well if people are interested. And so this is just summarizing the compiled data shown here in terms of counties around these 18 states. There's around 7.8 thousand community water systems total included here, and they serve 70 million people in total. And for this study, all of our data that we used to do the analyses are available online at this link. And since the conclusion of this study, which ended in 2023, we've since updated these data and now have data on 27 states, including 10,000 community water systems serving 94 million people. So I'm mostly going to be talking about the data on the left here, but this updated version, we have some representative data available online. I'm also always available to and talk or contact on additional requests for these data as well. So I'm just going to give a brief overview of the analyses, just to give some context before I talk about some of the results of this project. So our first analysis is looking at the association between PFAS contamination sources and PFAS drinking water concentration. So again, this is a revisit of this 2016 study. And we make some direct comparisons to it that I'll show. But importantly, these are analyzing these concentrations at lower levels in terms of the concentrations that were quantified, and actually more water systems as well, in a different group of water systems that I'll talk about, and also at a subnational scale. So this is 18 states versus that prior study was nationwide in scope. And we're using these watershed units developed by the USGS that break watersheds into subclasses. So these are shown here. And we're using a spatial modeling approach based on locations of military fire training areas, airports, and these other possible PFAS contamination sources. So next, we're analyzing the relationship between sociodemographic factors and PFAS contamination sources. So here we're using data on racial ethnic composition and these area level socioeconomic measures. And then again, we're using these locations of these facilities. And really, we're trying to see whether these factors are associated with whether a system is coinciding with the contamination source in terms of being in its watershed. And this analysis is really broken down into two subparts. The first being more descriptive statistical analyses, where we're not really adjusting for any other factors. And then moving towards these more adjusted statistical analyses. We're trying to account for a variety of factors simultaneously. I'm really going to be focusing more on this second part later on. And this next analysis is related, but we're now analyzing this in terms of contamination specifically. And for this, we're using these two thresholds for these analyses. One, over 5 nanograms per liter for several PFAS. And that's based on analyzing the batch detection limits that were reported by the states, as well as values above, at the time, the lowest maximum contaminant levels developed by states. And again, we're using these sociodemographic measures and trying to understand whether these measures are associated with high rates of detection of these PFAS, these specifically being PFBS, PFHXS, PFAS, PFOA, and PFNA, as well as at least one PFAS being detected by that community water system. And this part is similarly broken down based on the level of statistical adjustment that we're doing, ranging from these more descriptive analyses to some more adjusted analyses, and where we're accounting for state level factors and water system characteristics, as well as these further adjusted analyses where we're including a set of contamination sources. So really this last part is asking whether we still see these associations after accounting for all of these observed factors. To give a brief data summary, so again, these community water systems, or CWS, analyzed in the study serve an estimated 70 million people in the US. 5 PFAS, the ones that I showed in that prior slide, were measured and reported most consistently across those 18 states. I think a lot of that owing to regulations that those states had in that time period. And then we found that about 1 in 4 residents, so 1 in 4 residents of these 70 million total US residents were served by a community water system that detected at least one of the 5 PFAS above 5 nanograms per liter. And notably, part of this relating to this 5 nanograms per liter threshold, we also observed that the batch detection limits reported by the states can often be much greater than the lowest available guidelines from the US EPA for PFAS. I think really highlighting the challenge in quantifying PFAS at those low levels. So related to our first analysis, we found in agreement with the prior study that several PFAS sources were predictors of drinking water concentrations. So some of that is described here in terms of the top 3 predictors from those models for PFOA, PFAS, PFHXS, and PFBS. Similar to that study, we found the single largest association with these historical manufacturers of PFAS. So describing this more specifically, an additional one of those locations in the watershed was associated with a 110% increase in PFOA in this case. We also saw associations for military fire training areas and airports that are certified to use firefighting foams. In this case, ranging from around 10% to 34% for PFOA, PFAS, PFHXS, and PFBS. And some of the newer additions to this model included analyzing wastewater treatment plant effluent volume specifically, as well as municipal solid waste landfills. In this case, we saw associations with PFHXS and PFBS ranging from around 5 to 7% for those 2 compounds. And then comparing more directly to that prior study is what this graph is showing, where I have several of the estimates from those 2 studies shown alongside each other. So our current study is shown in purple. This prior study from our lab is shown in orange. I'm showing PFOA, PFAS, and PFHXS for major industrial facilities historically producing those PFAS, as well as military fire training areas. You can see here how closely estimates from these 2 studies are tracking in many of these cases. And this is really despite differences in geographical coverage, so subnational versus national, differences in the water systems included that I'll expound upon a bit later, as well as differences in the resolution of the PFAS data in terms of detection limits that were available to quantify those PFAS. So really, even despite those differences, there were a lot of similarities between these 2 studies. I think going forward, before I move on, it's likely that future models that are able to analyze at lower PFAS at lower and lower levels will require really a broader group of smaller contributors to PFAS contamination. This is less of the focus of the talk today, but I think really an important factor to consider moving forward. So this is relating to the second part of this study, where we found broadly that community water systems sharing watersheds with PFAS sources served higher proportions of people of color. And so this is summarized in this figure here. And the exact details on the statistics are less important, but we can see for the percent of Black and Hispanic residents, as these groups are increasing by 1 percentage point, we see the change in the likelihood of having a PFAS source in that watershed is increasing by about 10%. For a military fire training area specifically. We did see kind of contradictory to our initial hypotheses that relationships with percent of the population below the federal poverty line was reversed, where as this group is increasing, we're actually seeing a decreased likelihood that these sources are co-located with a community water system. And I'll dig more into this in a few slides on that finding specifically. And then related to our third analysis on that study, we found that community water systems with detectable PFAS also serve greater proportions of people of color. And so this graph is summarizing this as well, whereas you move to the left, you're seeing these detections that are less likely, and as you're moving to the right, these detections are more likely for these 3 factors shown on the left. So as an example, as the percentage of Black residents is going up by 1 percentage point, we're seeing 3 to 6% increases in the likelihood of PFAS detections, specifically PFOA and PFAS, but as well as for at least one PFAS. And similar associations were found for Hispanic and Latino residents. And then finally, again, in agreement with our prior analysis, we found that residents under the federal poverty line were inversely associated with detection. And importantly, so all of these associations shown in this graph are from our fully adjusted models, where we're accounting for a variety of factors, as I mentioned. And then the levels analyzed here, kind of bringing us back to the recently finalized regulations, are above those two regulations for PFOA and PFAS at 5 nanograms per liter. And then this, I think, is another way of viewing some of these results, but instead across the distribution, and where we found across that distribution that systems with detectable PFAS serve greater proportions of people of color. So this graph is breaking this down by percentiles of people of color served by systems that had and didn't have PFAS contamination above 5 nanograms per liter for at least one of the 5 PFAS that we analyzed. And we're seeing this from the 50th percentile, so the median on the left, going up to the 90th percentile all the way on the right. And as you can see, so at the median, systems that detected at least one PFAS are serving 24% people of color compared to 13% for those that did not detect PFAS. And this is going up to 52% versus 35% at the 90th percentile. So really the takeaway here shown by these non-overlapping bands is differences across the distribution between systems that serve and don't serve, or serve and do and don't have PFAS contamination above 5 nanograms per liter across these sampling data. And then bringing it back again to our findings related to socioeconomic disparities. So again, we found among all water systems that residents under the federal poverty line was negatively associated with PFAS contamination. And we analyzed this, as I mentioned before, with a set of other socioeconomic factors, and these were all consistent in terms of their direction as well. And so in our compilation of some of the PFAS source data, we noticed that some of the PFAS sources we analyzed were more common, more prevalent in urban areas of those 18 states, urban and industrialized areas of those 18 states. And in terms of the socioeconomic data at the county scale that we're analyzing, urban counties tend to have lower poverty rates than more rural counties in the US, which we attribute as a possible reason for this initial finding. And so because of this, we ended up splitting our data set into these more urbanized systems and more rural systems, depending on the population living in urban versus more rural areas. And we found actually among more rural systems that this population was associated with increased likelihood of contamination. But again, among more urban systems, that we found this negative association again. So I think in general, this is really implying differences across rural and urban scales, specifically related to socioeconomic disparities for PFAS contamination. And so before I discuss more on the data gaps and what I think they can teach us, I want to just give some key conclusions of this work. So the statewide monitoring data that we've compiled show sociodemographic disparities in PFAS exposures through drinking water. And these occur in part due to siting-based disparities in the sources that we've analyzed as part of this study. And then several PFAS sources, in agreement with the prior study on nationwide survey of PFAS, are predictors of PFAS concentrations in community water systems. So here I have 3 main data gaps that are related to limitations of this study, but I think really would deepen our understanding of these issues going forward. And so the first here is related actually just to gaps in drinking water monitoring nationally for PFAS. So first, more on the researcher side, with quantitative analyses of observational data and experimental data in some cases, generalizability is often a key consideration because it can threaten whether we're able to make generalizable generalizations based on our findings. So whether we can really attribute our findings to being applicable to a larger group of systems in this case. We found the systems analyzed here are similar to systems nationwide, but still, due to some lack in monitoring nationally, our generalizability is going to be more limited to those 18 states. But I think stepping out of the researcher kind of role, these gaps are a concern more broadly for public health monitoring. Although, as I mentioned, data are quickly becoming available, both through ongoing state monitoring that's still happening, the new unregulated contaminant monitoring survey that's happening currently, as well as the interventional monitoring that will be part of monitoring for the recently finalized regulations for public water systems. And beginning to dive into this a little more is shown in this map. For here, I've combined monitoring data from the prior nationwide survey, the statewide collected data that I discussed today, as well as the ongoing unregulated contaminant monitoring survey up to 2024 in this case. So I took these data and then I cross-referenced it with some of the data on the total number of active community water systems in each of these states. I'm really trying to understand what percentage in each state have done some kind of monitoring across these three data sets. And we can see there are still some sizable gaps in monitoring in terms of the number of systems across the country, especially as you go outside of the East Coast and the Midwest. So many parts of the West and the South as well. And I think information like this can really help us understand which areas have or have not systematically tested for PFAS across these initial surveys. And trying to go into this even a bit further is breaking this down by system size among these community water systems. And when we do this, we can begin to see some really clear evidence of differences that are dependent on the size of those systems. So on the left is showing the breakdown of system size among all active community water systems in the US is around 50,000 total. The majority of these are small or very small systems, and this is dependent on the size of the population served by those systems. Although it's not shown here, but these larger systems comprising around 8% actually serve the majority of the population in terms of just sheer numbers of people. And then on the left, on the right is showing this breakdown among these three monitoring data sets. So the initial survey in 2013 to 2015, the statewide sampling data I talked about today, as well as the ongoing survey that the EPA is conducting. So here you can see there really are clear differences among these systems. So in the UCMR3 survey, 2013 to 2015 survey, this intended to analyze all of the large or very large systems. So there's clearly a gap among those data for these smaller, very small systems. Similar trends currently for the UCMR5 ongoing nationwide survey, where large and medium systems are overrepresented in comparison to all total systems in the US. We do see among the state data more similarities between these two in terms of greater representation of these smaller, very small systems among those data. And I think this, even though these systems serve a smaller population, I think the design of these surveys can really improve in the future with greater inclusion of these systems, because we know from other studies that these systems often face more financial and technical barriers in maintaining drinking water quality, as well as maintaining conveyance to their consumers. And then we also can see there is also a pretty stark lack of monitoring for Native American and tribally owned systems across all three monitoring data for PFAS described here. So these Native American and tribally owned systems are recognized by the EPA in terms of ownership of public water systems. And this orange bar is showing the total number of systems as a percentage that have no monitoring across these three data sets. And then the other three, the groups of systems included in those other three data sets are shown at the bottom. And they comprise in total only about 4% of the total number of Native American tribally owned systems. In terms of population, these systems serve about 20% of this total population. But so clearly, even in terms of population, there still is a gap in monitoring. These gaps have been highlighted by other researchers, particularly for these federal surveys of unregulated contaminants. I think it's a real necessity to ensure that the design of these surveys from the beginning is built to include more of these systems, really to ensure more equity in sampling at these early stages of understanding contamination around the country. So related to the second data gap that I want to discuss is based on granularity in characterizing populations served by community water systems. So we're analyzing our data at the system level, but we're linking them with county or counties in terms of the populations that they're serving. And we're doing that because it's the most available currently in the administrative data on community water systems. And in many cases, there are systems that serve populations at the county scale, but systems also often serve populations that are more granular or less defined scale spatially. And this is a noted problem for researchers throughout the drinking water quality and health space, both in terms of trying to estimate exposure for populations, trying to understand exposure disparities here, as well as answer questions related to drinking water quality and health as well. But I also want to highlight some progress on understanding this a bit better and being able to tackle this issue a bit better. So there's several efforts, including one highlighted here for Illinois, that are being undertaken to bridge this gap. And this particular effort is by Simple Lab. I'm showing their tiered data on community water systems that they've tiered based on data quality available. So going from these more defined and kind of surefire water system boundaries going to these less defined boundaries in terms of city, as well as these estimated boundaries that are shown in red. This is really a multi-sector approach, multi-sector effort with researchers, utilities, as well as the public engaging on trying to bridge this data gap. And I think it's going to be really important for studies like this, other studies going forward, in terms of trying to better ascertain the population served by a community water system. And then third here is just related to the numerous other routes of exposure that we know exist for PFAS. So exposures by drinking water are just one of the many possible routes of exposure to PFAS, unfortunately. So research attention is really also needed for these other routes of exposure. I think also with environmental justice lens, as we've done in this study. And before I close out, I want to highlight again this figure from my advisor. It's basically describing kind of from the source the exposure pathways and exposure routes to PFAS for humans. And we can see here consumer products and other environmental sources are important considerations for PFAS exposures. So our work really shouldn't just stop at drinking water. Of course, this also include locally caught seafood, identified as another pretty important exposure source for PFAS. And it's also a traditional and cultural practice for many groups around the US, particularly for indigenous communities. And then as I close out here, I want to reiterate that the federal PFAS drinking water regulations are really a historic development in terms of regulating PFAS. And these are actually the first new federal drinking water regulations that we've had in the US for a long time. And so it also becomes important for us to think about how we respond to these regulations. They, of course, could be a challenge for many water systems around the country. And we know there from prior accounts as well that systems serving these marginalized communities and serving these lower income communities can often face barriers to reducing drinking water exposures. And just as a slight plug in my own research, I'm hoping to understand this better in terms of drinking water treatment specifically, where we're trying to leverage existing drinking water treatment records over many years to understand which kinds of systems are facing barriers to adopting those treatment processes. And finally, as I just highlighted the current data gaps, I think environmental justice concern should really be a component of efforts to mitigate risk going forward. I think related to this, regulatory actors at multiple scales, federal, state in particular, should really be able to consider this when drafting sampling plans, so starting at the beginning, all the way to enacting remediation at scale for PFAS. And really for researchers as we're trying to better and better characterize exposures for communities to these class of compounds. And as I finish up, I want to acknowledge several different people here. So first, the lab group that I'm in, the Biogeochemistry of Local Contaminants Lab at Harvard. I also want to thank and acknowledge other collaborators on the work presented here, including Dr. Lowell Shader, my dissertation advisory committee, for their thoughts on this work, and my other ongoing research projects, as well as state agencies for providing drinking water data. I pestered them over many years. I want to thank them as well for all of these data, and also to all of you for attending this talk. So thank you. I'm ready to take any questions now as well. My contact information is also shown here. So feel free to email me as well if you have any questions.
Wow, very interesting. I'm excited to look at the data that you have. Reminder that you can type in your questions through the Zoom Q&A or the Whova Q&A.
I have a question from Whova.
Okay.
Will a part 2 of this study also look at blood serum levels in these populations and attempt to understand both correlation with water supply, concentrations, and potentially disparities within the exposed populations?
That is a really interesting question. I think that would be a great study to do. There are some existing studies trying to understand differences in serum concentrations primarily using NHANES data, so National Health and Nutrition Examination Survey data across a few years. And there are some studies as well trying to kind of tease apart the contribution of drinking water to serum levels. Some estimates around 20 to 30%, depending on which PFAS. So it's not currently planned for this study, but I think it is something that we'll see more research on in the future.
I have a question while we wait for more to come in either on Zoom or Whova. So I was struck by your slide. I actually even screenshotted it for myself. Your slide looking at the differences between rural and urban areas, and the fact that among urban systems, there's a negative association with contamination, and rural systems, it was positive. And I'm wondering, so what struck me is that across the country, the racial composition of urban and rural areas shifts, right? I think of a city like Chicago versus, in Illinois, the urban water system versus, a state like Mississippi, or, a southern state where you're going to see really drastic shifts in what your urban areas and your rural areas look like. And I'm wondering if you have any plans to kind of tease that out a little bit more to see what might be driving that.
Yeah, so in our own study, many of the racial ethnic disparities, particularly for Hispanic and Black residents in this case, so some of those were still evident among the urban systems, I think particularly for Hispanic residents, if I'm remembering correctly. We did see decreases when you're analyzing just the urban systems in general. So that would partially be evidence that there still are differences between, even among these more urbanized systems, in terms of racial ethnic disparities specifically. I think a lot of the initial disparity in the first models that I talked about are due to these urban and rural differences, because around the US, urban areas tend to have greater proportions of racial ethnic minorities than these more rural areas. That's due to a lot of factors, many of those being historical as well. I think it is still a really interesting topic. I think as well as we're getting more drinking water data, we'll be able to tease apart and answer some additional questions related to that. because we'll have data on other urban regions as well.
Yeah, I found that really interesting. It really struck me.
We have a question on the Zoom. The question is, how can we find the PFAS map that was referenced?
Oh yeah, I could probably put the link in the chat if that is easiest, because there is a link in the presentation, but that's probably not the easiest way to get it. So I can put it in the chat if I can find the slide. I may have to exit the slideshow, but I can copy this link and send it in the chat. So hopefully that went to everyone. I'm not actually sure if it did, but hopefully it did go to everyone.
It did.
Okay.
Oh, no,
Awesome.
it didn't, but I'll
Okay.
take care of it for you.
Okay, thank you.
Sure.
We have another question from Huva.
Mhm.
Can you talk more about why rural communities are more exposed to PFAS contaminants? Is it because of well water being less treated or other factors? Also, are there programs that you know of that can help communities test their drinking water, or do they have to be selected? Because I know PFAS testing can be not attainable at household levels because of expense.
Yeah, so related to the first question, we did find in general that the actually the more urbanized systems, the systems located in more of the urban regions of the US tend to be more likely to have these compounds at higher concentrations than the more rural areas. Specifically for rural areas, we did see differences related to socioeconomic composition. So urban areas generally were more likely to have PFAS than the rural areas, but of course in rural areas there still are contamination issues for PFAS. So that some of that could be stemming from other sources of contamination as well, including ones that aren't necessarily analyzed here. And then related to the second question on ways to get access to testing. Some states do have like a list of state certified labs to conduct testing. I think it does become more complicated for private water users. It does also vary, unfortunately, state by state in terms of the availability of testing, both for public and private water users. So for public systems, some of those are already doing PFAS monitoring as part of regulations, or they're part of the current campaign by the state, or part of a nationwide survey that's happening currently. A few states analyzed here actually offered free testing to systems as well, so they were paying for a state certified lab to do the testing. But for private water users, they're not under those regulations. So there will be those lists of labs often recommended by the state, but don't think in most cases it would be free for those users.
We have another question on Zoom. This one says, do you know if what you found in the US is similar to findings in other countries?
Yeah, that's a good question. I don't know if there are so many specific studies like this in across other countries. I think there are studies related to, if I flip through my slides, kind of this first question on sources of contamination and drinking water concentrations in other regions. But I'm not as aware of studies specifically focused on environmental justice or exposure disparities for PFAS in other countries, really with a drinking water focus. Although that doesn't mean that there aren't those out there. I'm not as aware of those.
We have another question on Zoom, Sarah and Beth. Do we have time for that one?
Yep, go ahead.
Okay. So this question says, as non-targeted analysis of PFAS becomes more common and drinking water regulations start to include hazard indexes for multi-PFAS exposure, how could this research shift? Would you consider, in quotes, semi-quantitative analysis of non-legacy PFAS, or start looking at, in quotes, higher risk PFAS?
That's a good question. My hope is that we do move more towards those non-targeted analyses for these kinds of monitoring data. I think that would be really valuable for public and researchers. It's not currently available. Actually, in many cases, some of the states are likely analyzing a large suite of PFAS, but aren't reporting a lot of those data. That's was really why in this case we only analyze 5 in particular. Some states actually report up to 40 compounds. But yeah, I do think we could move more towards non-targeted analyses in terms of monitoring data. I don't know if there are current plans to do that, unfortunately. But I think it is valuable as well if we're aiming to kind of move from this one-by-one approach to PFAS more to them as a group of compounds. Not a hard answer on that, but I think I would support moving more towards these non-targeted approaches for PFAS.
Okay, we are at the top of the hour, so we will conclude the formal Q&A session.